the framework allows you to do is really to stratify risk, which is not something we've really done before, and it means you can intervene appropriately for the level of risk. So a lot of risks turn out to be or can be dealt with what we'd call business as usual, which don't need huge interventions, and that of course is beneficial from the provider's point of view as well as from our point of view, and at the same time it will highlight high risk situations where significant and urgent intervention is necessary. And because we get that oversight over the whole variety of risks and training issues that we see, I think it's a very reassuring process.
I think we have a varying number of ways of looking at quality, looking at surveys, looking at other trainee feedback, looking at what educators say when they have to be reapproved every 5 years, and therefore we can look at that. We also look at the results of CQC inspections, for instance, and that helps us to decide whether we need to actually intervene and visit a practice and talk to the learners and talk to the supervisors, or whether we're happy for things to carry on as they are doing.
It's a very clear, concise description of what good healthcare education and training should look like. So I think its applicability across the board has been very useful, so we can use it in non-medical training environments as well as medical training environments, which is good because there's a lot of crossover now between non-medical and medical, so things become a little bit more fluid, so having something that's applicable to all is very, very useful.
In the past we have done this very differently, but now we're using the quality framework. When we're talking to our partners in other parts of the area, we're able to talk like with like. When we've got a particular quality issue in one part here in the West Midlands, we can compare that with the East Midlands and compare our risks and what we perceive as the right thing to do, and the right way and proportional way to approach those things.
I think that using the framework helps HEE work better with other organisations because we're more in sight with what's happening generally, and we're able to influence the way that organisation is delivering training to our learners.
A lot of it is about improving the learning environment, but also the interactions between supervisors and other people in either practices or trusts.
The biggest impact from the framework is giving it a structure. In the past, there may be various people saying, I think this or I've heard that, but the framework gives us a way to pull it all together and give us a basis to make some firm assessments and decisions that then help guide what happens next.
I think it enables us to be focused on what needs looking at, and it also frees up practices and trusts from unnecessary either visits or other interventions, so that actually they can get on with the job of training and providing patient care.
The benefits of having a risk-based approach is it allows optimum use of resource. It's helped us sort of clear a description really of quality management for schools to use, and also non-medical education as well.
I think it's more about how we work with trust to make sure that these issues that perhaps they've been wrestling with for a long time can move forward with us supporting them. So our learner visits, I think the way in which we look at risk now and manage that with heads of schools, manage it with directors of medical education and trusts, allow us that more two-way real time, rather than just sending off a report expecting a response to it. It's more in real time the way that we are sort of trying to support our leaders in education at trust level.
I think it's an efficient process, I think it's a safe process, and I think it is a supportive process.
I think the framework supports learners by helping to give them a voice. They're able to feedback any concerns they might have about their training experience into Health Education England, and gives us an opportunity to help shape their learning experience by listening to those concerns.
One thing that we must make sure is that we have good education supervision and clinical supervision for our trainees. And one way we assure us in doing that is to make sure that we are hearing the trainee voice.
For me, it's a vital way of helping to make sure our learners are getting a quality environment and the best that they possibly can from their experience within East of England. I think the framework helps to ensure that patient care is as good as it possibly can be, where learners are supported in their placement and where they are supervised and given all the help they need to progress, then that helps to ensure patient safety at that point in time. But also by making sure that we help learners to achieve their best possible potential, then we're producing the workforce for the future, which is vitally important for patient care in the long term.
At the end of the day, this is all about the patient, and ensuring quality of training is about ensuring quality of care for the patients that we see.
It's all about all our quality processes, about improving our quality of care to patients, making sure that we've got good education and clinical supervision of our trainees. Ensures us that we are making sure they're looking after our patients in the best way, and in the future they can become leaders and educators themselves.
The biggest impact is it does give you a very nice overview of what's going on. As I say, it does enable you to deal with every issue appropriately, and I do think it gives you the confidence that you're keeping up to date really with the quality issues out there, and it gives you a tracking mechanism by which you can ensure that they've been dealt with or are being dealt with.
So my main message about the quality framework would be to engage with it, to make sure that if you're a learner or a supervisor and you're asked to take part in a survey, please do that so that we've got the maximum amount of information to decide whether any intervention is needed or whether actually things are going very well, and people should be left alone to provide good training, learning and good patient care.
I think my main message would be that it's there to support trainees in education. They're such a vital resource within healthcare. We all know that workforce, it's the backbone of the NHS, this really fantastic resource. We need to train and educate them properly, so it's there to support them, and therefore it will improve patient safety.